Hello, and welcome to today's show. I'm Jamie Smith, Cancer Control Specialist with the Kentucky Cancer Program, and your host for today. I'm joined by Kathy Rorer with Restoration Physical Therapy. Physical therapy is an important part of the recovery of many illnesses, including cancer. And today, Kathy has joined us to discuss physical therapy and her holistic approach to recovery for not only cancer patients, but others as well. Thanks for joining us today, Kathy.
Thank you very much for having me.
If you just want to start, just kind of talking a little bit about yourself, your education, and your practice and programs.
Okay. Well, I was born and raised in Paducah, Kentucky, and I went to the University of Kentucky and graduated with Bachelor of Health Science in Physical Therapy. I've been working as a physical therapist for 24 years, so quite a long time. In December of 2008, I received my doctorate in physical therapy from the Des Moines University, and I also opened a practice last year in November of 2008. And we'll have some clips of my practice and inside my practice and some of the things that we do there.
Okay.
I do take a holistic approach to most of my patients. I do see men and women, I want to make that clear, but I do a lot of holistic programs for women specifically. And I think it's very important that, that we heal in our body, our mind, our spirit, and that is just the approach that I like to take. So for health and wellness, that is key, and I believe that's the only way that you can be a healthy person, to include all three of those areas. You will see here in the video clip just some of the people exercising at the clinic. We have the free motion equipment, we have ellipticals, recumbent bikes, upright bikes, an arm bike that you'll see here in a moment. I also have an esthetician in my practice, and the reason that I have her there is because I think it's very important to have healthy skin, and she does educate people a lot in that area, does facials and that type of thing, but also teaches them about how to take care of their skin. We do a lot of education in the practice, and just always take the approach that it's more than just your physical body, it's also your soul and your spirit that we want to work on to get to that level of wellness. This is a gentleman working here on the arm bike. This is a program we have called Pelvic Core Fusion, and it works your body in lots of different ways. It's an aerobic exercise program. It works the entire core. The core includes your diaphragm, your back muscles, your abdominal muscles, your butt muscles, and actually your whole pelvic floor. So it is an aerobic exercise program which will increase your endurance, it increases strength, it works on balance and coordination, so it's an excellent, well-rounded program. And it does help with back pain, it helps with incontinence, it helps prepare women for childbirth. Their childbirth works so much easier, it's so much easier to have a child after you have conditioned and worked your pelvic muscles. And so it's just a great exercise program all around. And we do offer this when someone comes in and wants to do the Pelvic Core Fusion classes. I will do a health and wellness evaluation prior to that. Then we will go through 8 sessions, and at the end of the sessions, many people have wanted to purchase the ball you see here. It's called a Pelvic Core, and there is a video that they can take home with them as well, and they can continue this exercise program. While they're there at the clinic with me, I just make certain that they're performing the exercises correctly, that they are using the proper muscles and the proper technique. The unique thing about this pelvic core ball is that you are either squeezing in on the ball or pulling out against bands with every movement that you make, and it just really, really works the entire core. Other exercise programs that we have, I have a Restore program. I developed this when I was completing my doctorate, and it is a holistic approach to an exercise program for women with breast cancer, and they can either be going through breast cancer or they may have recovered from breast cancer. And this is what it means. Restore stands for regaining endurance, self-esteem through ongoing rehabilitative exercise. There is a 12-week program that is exercise that will meet 3 times a week. And we do some aerobic exercise, some strengthening, and it is all related to the research that is available now. We have learned through research that it can make a huge difference in your recovery. You may be going through chemo and feeling really horrible, but if you are in an exercise program, you can gain some strength, you can reduce your fatigue levels, which is huge with cancer patients. And we've just learned that there is so many benefits to gain from performing exercise while you're going through cancer. And the benefits are long term. There is some research available that shows that 10 years after women have breast cancer, they may still be having the effects of fatigue. And that, that is a long term problem. So that through the exercise program and the other areas that we offer, you can just make a big difference and gain some benefits for the rest of your life. I also have a dietitian who does private consultation, and nutrition is huge when you're having breast cancer and all the time. But she does come in and do private consultations for those who wish, and that is true in every aspect of my practice. For those who have diabetes, that's something that sometimes I recommend. There are the esthetician is involved in the Restore program. She has some training in the hair loss aspect of it for the eyelashes and the eyebrows, and just making yourself look better will help you feel better, certainly. There are health psychologists that are willing to help with the program and speak to people about the problems they may have or the concerns they may have while going through the breast cancer. I also do a health and wellness type series that just works and educates on optimal health, on things that you can do for prevention and for stress reduction, exercise, nutrition, pretty much
stress
the whole
reduction.
Yeah, that's true. Pretty much the whole gamut, and that's a 12-week program.
Okay.
So there are all kinds of programs available. I do have a website, and that will be up on the screen here shortly. But you can call me at any time. The number is 270-554-2883. I know some people just call and want to know if they can come in for a consultation, and that's perfectly fine. But I would call beforehand. I can probably save you some time and tell you which direction you need to go.
Okay. Well, all those really sound like neat programs that you have, and it's great that you've actually kind of designed a program specific for breast cancer survivors, but other people can benefit from that as well. But definitely all the aspects that people would deal with while they're going through treatment and recovery of breast cancer, you certainly highlight all those, and so it sounds like a really great program we hope women will take advantage of. And of course, men can have breast cancer as well. So again, it is for men and women. You also provide community educational seminars, and you've talked a little bit about how you're in this for community health as well. So these seminars can be beneficial to everyone in the community. And so if you just want to take a few minutes to talk about that as well, we'd love to hear about that.
Okay. I have spoken at several support groups in the area, breast cancer, fibromyalgia. I will kind of gear whatever group I'm talking to, I will design the program for that. But I think education is empowerment, and I am a big believer in education. I also educate my patients anytime they come in with a problem. A lot of times they don't understand, or the doctor's not had time to teach them about what's going on, and I think that it is just huge to educate people. For instance, if someone comes in with a problem, a disc problem, or a back problem, I will take the spine and show them, maybe look at their MRI or their CAT scan and demonstrate to them on the spine what actually is going on. This, of course, is a replica of the spine. This is showing a herniated disc here at this point. and we'll just go over the anatomy of the spine. I'll talk about the disc and the vertebra, how wear and tear occurs, how the disc can get torn, and it makes it so much easier when they understand what's going on.
Right.
They're much more likely to follow through with their exercise program when they understand what it's doing. So I try to do this in every aspect. If a person comes in with a shoulder problem, we'll take a replica of a shoulder and we'll go through the different problems that they're having and why they're having them. And it's just amazing how much better they respond and how much, you know, they're going to do their exercise programs and they're going to know why they're doing them so that they will continue to do that. And I will speak, I speak at churches, speak for clubs, have spoken in industry and on various topics, back care, injury and disease prevention, stress management, nutrition. We'll talk about osteoporosis or lymphedema or fibromyalgia. So there are several different things I can do.
Wide variety of topics that you do. It's great. Well, you promote a holistic approach to wellness, and we've heard you use this word holistic before. So you've briefly talked about it, but if you could just go into a little bit more detail about exactly what all that consumes, I guess.
Okay. Well, we are a spirit, we live in a body, and we have a soul, which is our mind, will, and emotions. And if you just work on the physical body, you're not going to get anywhere. If someone is having some huge emotional problems or they're having difficulty just, you know, making it day to day in life. So when I see that problem going on, there are certainly a number of resources I can pull from to help that person or to at least refer them to an area to gain some help. And nutrition is something that I have quite a bit of knowledge in, but if I don't feel like I have the knowledge, I will call in my dietitian.
Right.
I just think it's so important to look at more than just the body, the physical body, and unless you do that, you're not going to reach the wellness that you could.
Right.
To gain optimal wellness, you really need to look at all three aspects.
That's great. Well, it certainly sounds like you have a lot of programs that are very beneficial there, and also your community involvement with educational seminars, and then again your holistic approach is going to be something new for some people out there. They may have never heard of that before. So hopefully someone's learning something out there today and may be interested in learning a little bit more and perhaps visiting your practice to see what it's all about. We're going to take just a short break, and when we come back we're going to touch a little bit more on some of the things you've already talked about and go into a little bit more detail, and then also cover some new things as well. So we'll be back in just 1 second, just to join us back. Hi, and welcome back to today's show. I'm joined with Kathy Rorer from Restoration Physical Therapy, and she's been telling us a little bit about the programs that she has there at her practice and her holistic approach to recovery for physical therapy. And today she's talked to us a little bit about one program in particular that was Restore, which was for breast cancer survivors. And one thing that breast cancer survivors can deal with is lymphedema. And so maybe you could take just a few seconds. I know it's kind of hard to do that in a few seconds, but kind of tell the viewers what lymphedema actually is.
Okay. Lymphedema occurs often after breast cancer, And there's actually two kinds of lymphedema. There's primary lymphedema, which you can be born with, and there's secondary lymphedema, which occurs oftentimes after breast cancer. And secondary lymphedema can occur when the lymph node system is interrupted either through surgery, through radiation. At times it can even be interrupted through chemotherapy. But what happens when the lymph nodes are missing or they have been damaged, they no longer can filter the lymph fluid. And the lymph system is a whole system throughout our body in itself, and it's actually part of the immune system. So when your lymph system breaks down, that's not good for anybody or anything that's going to happen to you, because you're at much greater risk for all kinds of disease.
Right.
So let's take breast cancer for instance. If the axillary lymph nodes are removed, or some of them are removed, or if they are damaged through the surgery, then when the lymph comes to that area and it's not filtered appropriately because of those lymph nodes, then the arm may begin to fill up with the lymph fluid. There are capillaries inside our arms, lymph capillaries, and they have little valves on them. And after the lymph has just remained there and kind of overflowed those capillaries, they no longer work, and they're never going to be able to work again. So there is no cure for lymphedema, unfortunately.
Okay.
However, there are things that you can do to help remedy that situation. But to go back to the reason for lymphedema, after those lymph capillaries valves no longer open and close, there is no way for the lymph to be pushed out of the arm, so it continues to swell. And without some intervention, that lymph is just going to remain there. Well, that puts you at risk for lymphangitis, for cellulitis, for all kinds of infections to occur. Besides, it's very uncomfortable. It can be painful at times. Your clothes do not fit appropriately, and it's really a problem. So there are treatments that we can do, and the treatment that I do and I'm certified in is called complete decongestive therapy, and there are 5 parts to that. One is teaching the person about meticulous skin and nail care so that they don't cause any damage to their skin. Even dry skin, a crack in the skin can allow infection to get into the arm, and that can be deadly. Teaching them remedial exercises to work on the lymphedema. There is something I do called manual lymph drainage to help facilitate the lymph throughout the entire body. And then medical bandaging is applied. And that bandaging applies compression that will push the lymph out of the arm. And when people are going through this process, they come 5 days a week. They wear their bandages until they come back the following day, and then they're removed. They can wash their arm. We do the manual lymph drainage again, and then reapply the bandages.
Okay.
So the ultimate goal here is to attempt to get that upper extremity to the same size as the normal extremity. When that occurs, or if the reduction plateaus, then we measure for a customized garment. It is a compression garment. Usually we use a sleeve and a gauntlet, which is a little glove with the fingers, the ends of the fingers out. And then the person is able to manage their lymphedema independently from that point on. And there's a lot of good evidence that shows that is the best way to manage lymphedema.
So as a person wears a sleeve and perhaps they have a reoccurrence where the lymphedema swells back up, do they have to come back and go through that same process again for the 5 days?
Yes, oftentimes they do.
Okay. So this is something they learn to live with throughout their life, but obviously there are ways that they can live through it comfortably.
Yes.
And you can certainly help them with that. That's great. How often, well, you've talked about with the lymphedema, but moving on to other physical therapy aspects, how long would a person actually come for treatment at your facility?
It varies on their condition.
Okay.
It may be 3 times a week for 2 weeks. It may be for 1 visit, just instruction in a home exercise program. There are some folks who may stay for 4 weeks or 6 weeks, and some programs, like the Restore program, are 12 weeks long, so it varies a great deal.
Okay. All right. And then you've talked a little bit about consultations and You've said that those were free, that they could come and do that with you. But what are the other costs that someone may encounter whenever they come to your practice?
Well, for most conditions, insurance will cover.
Okay.
I'll have to say that all insurances are different, and what
Right.
we do is look at the person's insurance and contact the insurance company for them and find out what their benefits are and what will be covered before we start treatment. That way they know up front what's going on, we have an idea of what's going on, and we can let them make the decision about what they want to do at that time.
So no surprises later
No
on.
surprises.
That's good. And how is a person actually referred to your office if they were wanting to get treatment?
Well, they can self-refer, or they can, a physician can refer, a chiropractor can refer. We are able to take self-referrals because in the state of Kentucky, we can evaluate and treat without a physician's order.
Okay.
However, most insurances will require a physician's order. And if you have any questions about that, just give me a call and I'll be glad to talk to you about it.
Okay. And if you wouldn't mind just telling some people how they could contact your office, and we could go ahead and get that up on the screen so that they have a couple chances to write that down.
Okay. The number is 554-2883. I have a website that is listed there. Also, you can contact me by email, and that is restore@live.com.
Okay. All right. And they've got your hours up there, Monday through Friday, 8 to 5. And so they can contact you about that. And then it also talked about where you're located. I gave the address, but if you could kind of give people maybe a physical, kind of some description. Some people do better by where you're located around.
Right. Well, it is on Lone Oak Road, and it is between Lone Oak Little Castle and Corral Pools and Spas.
Okay.
And it is underneath PB&J, Dr. DeWeese and Dr. Patel's office. If you go to the back of the parking lot, there is a ground entrance.
Okay, so they can park around back then as well?
Yes.
Okay. All right. Well, thinking about everything that we talked about today, there's so much that those viewers at home have learned and been able to take in, but what is the one main message that you want the viewers to be able to take home with them today?
Okay, you can catch disease, but you can't catch health, and it's very important to maintain health. It will actually save you tons of money if you maintain your health. With what's going on in the world today, and insurance very likely going to change shortly, it is just a tremendous responsibility for us to take care of our own health, and it takes effort, it takes time, but it'll be well worth it for your future.
Okay. And I liked what you just said, that very first sentence. You want to repeat that one more time? Do you remember what you said?
You can catch disease,
Catch
but
disease.
you can't catch health.
And I think that's very good for people to kind of think about and take that back with them, because we've talked about physical therapy just being something that people may think of, well, I've been injured. I was in a car accident, or I was injured, doing some sort of activity. But these programs can be beneficial for everybody, not just those that need physical therapy. So that's very, very important for people to remember, to be proactive, I guess, in their health. Okay. Well, Kathy, you've certainly told us so much today about all these programs, and we've seen some video of what you can do there at your practice. And one thing I want to go back and talk about in that video real quick is what we saw, different machines. You had an elliptical machine on there.
Yes.
And some people may not know exactly what that is and why it's so beneficial than perhaps running on a treadmill or something like that.
Okay. Well, an elliptical is an aerobic exercise, so it will increase endurance. It also works on strength. It's excellent for those people who have knee problems because there is not as much pounding on the elliptical. Okay. If you are walking on a treadmill or walking, those are great exercise programs. However, if you have some knee problems, it's just like you're pounding every time you hit the pavement or you hit the treadmill, and that increases the pressure in your knees. And if you already have bone on bone, that's going to be very painful. So the elliptical is an excellent alternative.
Okay. And can the elliptical machine, can it do the incline and the decline as well, like you can with a treadmill, or?
No, but you can change. Most of the time there are programs, and they're certainly on mine, that can increase the difficulty.
So there's different intervals that they can take with that.
Yes.
And the other thing that I saw that was really interesting, when the man was using the hand bike,
Yes.
there was some sort of screen in front of him that he was looking at. What exactly was on that screen?
Oh, that was just showing him how he was doing and where he was as far as the level that he was on and if he was reaching that or not.
Okay. Well, that was very interesting. I enjoyed those clips and seeing the different things. And the pelvic core program was definitely something that was very interesting, and I could see why people would want to get the pelvic core ball and take it home with them. I would be one of those people. Well, Kathy, I just want to thank you for joining us today, and I've certainly learned a lot, and I hope that the viewers at home has as well. You certainly give us a lot of information that we can take with us and use to make our lives better, and hopefully we can take advantage of the resources that you've given our community to be proactive in our health. And hopefully those people out there will learn that not only physical therapy can be from just different sorts of illnesses, but also we talked about cancer, and of course that's one of my major focuses in my professional career. And like you said in there, cancer patients really can benefit from programs like this because there's so many different aspects that they deal with while they're going through treatment. So I hope you've enjoyed today's show, and if you're interested in learning more about restoration physical therapy or perhaps having your own health screening with Kathy, you can contact Kathy's office again. We'll put that graphic up one more time. The phone number is 270-554-2883. And again, the website is up there, and her address is 3530 Lone Oak Road, Suite C, Paducah, Kentucky, 42003. And if you have any questions about today's show, don't hesitate to contact our office, the Kentucky Cancer Program, at 270-442-1310. We hope you've enjoyed today's show. Thanks for joining us, and join us next time.